This video is to help you understand your transplant medicines. After a kidney transplant, changes in medicines can be frequent, especially in the first few weeks. Some of your medicines may stay the same, other medicines may stop, and new medicines start. This is why it is very important to always keep an up-to-date list of your medicines. The body has natural defenses to protect you called the immune system. They attack things that don't belong to your body, like germs. The body's defenses recognize your tissues and organs, but they see a kidney transplant as different from your own body, and their job is to attack it. This attack damages the kidney transplant and stops it from working. This is called rejection. Taking anti-rejection medicines lowers the body's defenses and protects your kidney transplant. You need to take anti-rejection medicines long-term. Without them, your kidney transplant will be damaged by the body's defenses and stop working. The transplant team will look after your anti-rejection medicines. Only they will tell you if you need to make any changes. Taking your anti-rejection medicines keeps your kidney transplant working well. Tell the transplant team if you miss doses for several days or weeks. If you forget a dose, take it as soon as you remember. If it's nearly time for the next dose, miss the one you forgot and continue as normal. Never take 2 doses at the same time. Most medicines have side effects. Remember that only some people get side effects and most people feel fine. Some side effects can get better and even go away over time. Speak to the transplant team if you think you have a side effect caused by your transplant medicines so they can help you. With most medicines, you can drink alcohol in small amounts. Check first. Other medicines can affect how anti-rejection medicines work. Check with the transplant team before taking any new medicines, herbal medicines or supplements to make sure they work well with your transplant medicines. Paracetamol is usually the best painkiller for people with a kidney transplant. Avoid painkillers called non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and diclofenac, because they can harm the kidney transplant. Anti-rejection medicines lower the body's defenses, and this can make it harder to fight infections. Tell the transplant team straight away if you think you have an infection. For example, if you have a high temperature or a sore throat. This way, they can help and stop you from feeling very poorly. Avoid close contact with anyone who has an infection to stop you getting infected, especially if they have chickenpox or shingles. With lower body defenses, you need to have vaccines. Only some vaccines suit people with a kidney transplant. Contact the transplant team to check which vaccines are safe and avoid live vaccines. Taking anti-rejection medicines makes having some types of cancer more likely, especially skin cancer. Keep away from the sun and avoid sunbeds. Protect your skin from sun rays with clothing and a hat, and wear high SPF sun cream every day. Tell the transplant team if you notice any changes in your skin, like new moles or a mole that changes shape or bleeds. Some anti-rejection medicines can reduce the number of blood cells the body makes. The transplant team will monitor you regularly and check your blood cell counts to make sure the levels are good. Tell them if you bleed or have bruises and you don't know why. Some transplant medicines can harm the unborn baby. This is why women must use effective contraception to stop getting pregnant whilst taking these medicines. Many women and men with a kidney transplant have healthy babies. Talk to the transplant team first if you're thinking about having a baby or fathering a baby. They can advise you which transplant medicines will work best for you. Remember, always take your anti-rejection medicines to protect your kidney transplant. Tell the transplant team straight away if you have an infection. Protect your skin from sun rays. Talk to the transplant team if you're thinking about having a baby.